a very important question in BBL surgery is the safety of the procedure. And we get a lot of inquiries regarding that. And I think to understand the issue of safety in BBL surgery, one has to know the history of the procedure. So 10, 12 years ago, when this started to kick off, and it was not widely popular, surgeons were logically using thin syringes and cannulas to inject deep into the buttock. In those days, we used to think that injecting fat into the muscle will help the fat to survive better, because muscle is a bone-perfused tissue. Tragically, we found that infiltrating fat into the muscle runs the risk of perforating a vessel inside the muscle, and with a syringe you can accidentally inject a fat bolus into the vein, which can lead to fat embolism, which is a possibly lethal complication. This is something that we understood a couple of years ago, and we understood that the answer to this is not to inject fat with a syringe deep into the muscle. But instead, today, we use what we call Vibration Lipofiling. It's a technology that was invented by New York surgeon Daniel Del Vecchio, and it implies the use of a blunt cage-type cannula, which cannot perforate, a vibrating handpiece, and a continuous flow fat infusion, which avoids bolus injection. You see the cannula is angled away from the muscle, so it is literally impossible this way to lacerate a deep gluteal vessel. So we consider this technique the cutting edge and modern technique, which is totally safe against fat embolism. However, unfortunately, we are aware that many surgeons still use this technique. So I always suggest to make sure that your surgeon is using a modern infiltration technique. It's technically demanding to do it this way, but it's important and it makes the procedure safe.